It might seem too early to be talking about the flu shot, but this year experts warn of a combination of two different viruses overwhelming hospitals. Delaney Sweet got her flu shot in August, 3 months earlier than usual.
I just think you should just do it because as soon as it starts to get cold outside, flu season's going to gear back up.
Some of the U.S.'s top doctors aren't just urging the public to get a flu shot, they're asking people to get it earlier.
Our hospitals and doctors' offices fill up as it is in December and January when it's cold and flu season. And having COVID-19 on top of that really runs the risk of overwhelming our healthcare system.
A bad flu season can really put certain hospitals into a medical stress situation.
The CDC says about 50% of Americans get the flu shot. They're hoping this year that number is closer to 65%. The American Medical Association is recommending anyone 6 months and older get their flu shot by Halloween. Physicians are also preparing for COVID's impacts on flu season 2. Dr. Scott Joy at Swedish Medical Center in Denver, Colorado, tells Newsy clinicians will need to be very sharp judging symptoms. While few differ between COVID and flu, many of the symptoms, like body aches, could be either virus.
If it's sudden onset, high fever, we're going to think more influenza. If it's loss of taste or smell, we're going to be thinking of COVID-19.
Dr. Joy says he also expects COVID to mean more televisits instead of in-person visits at the clinic. He has suggested already to his patients they get home medical equipment in case symptoms pop up, like a thermometer, blood pressure cuff, and pulse oximeter.
So if a patient calls and their oxygen level is a little borderline, we could say, hey, why don't you keep an eye on that overnight and let's do another televisit in the next day or two.
Doctors and experts are also watching countries in the southern hemisphere. The flu season there has petered out, the CDC director says, because of COVID-related precautions.
Wearing face coverings or masks, social distancing, washing your hands, being smart about crowds. They're not specific for COVID. They're going to work for any respiratory virus.
Lindsay Thies, Newsy, Denver.